Today, we have gathered here to celebrate the beauty and strength of womanhood, to foster a community of support and to explore the multifaceted aspects of women's wellness. Throughout the day, we will engage in meaningful talks and panel discussions and connect with like-minded individuals who share our passion for holistic well-being.
The summit is not just about physical health. It is also about nurturing our emotional and mental well-being. It is about recognizing the importance of self-care, self-love, and self-empowerment in our lives.
To kickstart our first session on weight loss, lifestyle, PCOS, and childbirth concerns in the 20s and mid-30s, we have with us Dr. Aruna Muralidhar. Dr. Aruna Muralidhar, consultant, obstetrician, and gynecologist with 2 decades of rich and varied experience in India and the UK. In the UK, she worked in world-class hospitals such as Addenbrooke's Hospitals in Cambridge and Norwich University Hospital in Norwich, in various subspecialties such as maternal medicine, high-risk pregnancy, urogynecology, and many more. She has been conferred a fellowship from the Royal College of Obstetricians and Gynecologists in 2018 in recognition of her contribution to the advancement of the field of obstetrics and gynecology. Her special interests include obstetric critical care, perinatal mental health, conservative gynecology, and many more. She believes in a balanced life and regularly pursues her hobbies of Carnatic classical music, endurance running, art, poetry, and tennis. She has recently authored a book about pregnancy titled 9 Months, The Journey of a Lifetime, which is creating waves in the space of women and pregnancy. Dr. Aruna, over to you. Ladies and gentlemen, our first speaker of the day.
Thank you very much indeed for that lovely introduction, and it's really a pleasure and an honor to be here with you on a Saturday morning in lovely Bangalore. My topic for today is actually quite a long one, in the sense it encompasses a spectrum of things which I'm sure every one of us will relate to. My slides on the screen, please. Yeah? Great. So I have been given this topic, which goes from weight loss, lifestyle, PCOS, which is polycystic ovarian syndrome, and childbirth concerns, 20s to 30s, right? So I put everything here so that I don't miss any of these, right? And I'm sure all of us would relate to some of these things as I go along. My disclaimer for today is, yes, I'm an obstetrician gynecologist with special interest in public awareness about women's issues. I run PCOS clinics at my clinic and hospital. I don't belong to the sponsor hospital, which is Motherward Hospital. I do I have presented several talks on the topic in the national international conferences. Currently, I'm conducting studies on the prevalence of PCOS in Bangalore and its symptomatology. And I've also written an adolescent book for school children to educate them about the changes that they undergo between 9 and 15 years of age. With that in the background, my outline includes this. What exactly is PCOS? Is it a real epidemic now? What's the sort of pathophysiology behind it? I'm not going to make it very radical, I promise. What are the causes? PCOS and fertility, some control measures, and of course, conquering PCOS, because there's nothing like a cure for PCOS. I think we all must respect, we all in the sense women here, must respect what we have in here, which is just about a fist size when you haven't been pregnant. Just this fist size is a lovely uterus, which is what God has endowed us with, the best NICU in the world. It can expand to about 10 kilograms when a woman is carrying twins. The water around the baby itself, the placenta, and everything else. Expansile, beautifully, nourished by blood and oxygen and all the nutrients that the baby needs. So a baby coming out at 27, 28 weeks in the 7th or 8th month really is going to miss all that lovely care that the uterus provides. And none of the NICUs in the world can compare to the mother's womb. I also wanted to bring your attention to some of the important structures that we have here. Is this the laser? Oops, sorry. The laser marker is this one, please. Anyway, fine. So essentially, Yes, so the ovaries are what is, bringing on the estrogen in our bodies, which give us, that glow, the skin, the beautiful skin, the strong bones, and the strong heart as well. And they're also producing eggs throughout our lifetime, right? When you look at our own sort of bodies, we have something like 35 to 40 years of periods, starting from about, say, 10, 12 to the time we reach menopause. That's about 420 periods a lifetime. So you can imagine the number of, sort of days that we're spending with, periods on. It's quite a, massive time that we spend in our periods, right? The wall of the uterus, inside the wall of the uterus is a lining which sheds during the period. And it's a beautiful cycle. The biological clock is so well adapted to, sort of shed the endometrium exactly 14 days after the egg is released. So the egg is released, it goes into the tube, actually the tube, the flowery end of the tube, picks up the egg so beautifully and keeps it in the tube until the sperm comes and meets it and fertilizes it, and then the pregnancy happens. But of course, if the pregnancy doesn't happen, exactly 14 days later is when the period comes, right? And it's important to understand this, cycle to understand what PCOS means in the first place, right? So a whole lot of respect for our organs down there inside us. And now coming to PCOS itself, right? PCOS, PCOD, PCO, PCOS, hormonal imbalance, hormonal problems, and I see girls using it as a status symbol. I've got PCOS, right? So whatever it is, what is it in the first place, right? So a little bit about the actual terminology. When we say polycystic ovarian syndrome, people start wondering, oh, are there a lot of cysts in the ovaries, big cysts, water-filled? That's not what it is. It just means there are many follicles which have eggs growing in them, and they're more than the usual, right? So it's actually a slightly misnomer. And it's a disorder rather than a disease. So PCOD is not the right terminology. It is actually polycystic ovarian syndrome rather than a disease. And essentially, it's mainly the hormonal imbalance, but it also comes with a whole lot of metabolic problems as well, right? And it can be transient if the woman takes the right steps at the right time, right? So is the epidemic real? Is PCOS a relatively sort of neglected non-communicable disease? Why is PCOS emerging as a public health challenge, right? Some basic facts. In Bangalore, I wouldn't even say 1 in 10. Almost 1 in 3 to 4 women that I see have PCOS or PCOS. It's becoming more common nowadays. It begins in adolescence, in early 20s. It's a condition, not a disease, and prevention, control rather than cure. So what is it? It's a complex hormonal, metabolic, and reproductive disorder. Leading cause of infertility, can lead to other serious conditions in the long term, such as severe anxiety, depression, obesity, even endometrial cancer, type 2 diabetes, and cardiovascular disease as well. Now, how does one know that they have PCOS? And that's very, very important for us because we shouldn't be underdiagnosing or overdiagnosing PCOS, right? So it's important to know whether they have a family history. Do they have irregular periods or no periods? Are they on pills? Do they have acne, which may be severe? Do they feel that there's more body hair or, on the face and stomach, unwanted body hair? And also the fact that the ultrasound shows polycystic appearance. So it's extremely important to understand that the diagnosis is very, 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 let's say, focused, and it has to be done at the right time and the right way. Now, when I see a youngster, let's say, 9 to 15 or 16 years of age, they will have polycystic ovaries when you scan them. That doesn't mean that they have PCOS. It just means that they're still maturing and their hormonal sort of, let's say, the signaling system is maturing. And this is the difference between a normal ovary and a PCOS ovary, right? Now, these are all, medical criteria that we use, but you don't have to really understand them. But there's very specific minor and major criteria to make the diagnosis of PCOS. Now, having made the diagnosis of PCOS, this is a very important thing to understand. Your genetics load the gun, but the lifestyle pulls the trigger, right? So even if you do have the genes within you and you're carrying them, we as thin fat Indians, we are called thin fat Indians because although we may look thin, we have a lot of visceral fat inside us, which give us already an edge over the others to develop non-communicable diseases like diabetes, etc. So having said that, this is how hunter-gatherers way back, agriculturals and industrials change in the way they metabolize fat. right? So you can see that hunter-gatherers were much better at metabolizing what they ate, right? Now, the etiology, we really don't know the actual cause of PCOS, but it's a genetic disorder with ovarian androgen secretion. That's the testosterone, which is causing all the unwanted acne and excessive hair, etc. Most agree that the ovary, rather than the adrenal gland, is actually the principal cause of this testosterone and the male hormone becoming more, right? The pathogenesis still remains unclear. It's a complex genetic disorder. Let's just understand that. But the most important thing is we need to understand there's something called insulin resistance, which is driving everything, which means the pancreas is producing insulin, but the insulin is not able to do its job. It's not able to metabolize the sugars at the cell level. That's called insulin resistance, and that's the basic pathology in PCOS. So these are all the various skin changes that happen with PCOS, and it's really distressing for young girls. It causes a lot of body image issues, a lot of anxiety, depression around it, a lot of social problems and social stigma as well, right? In terms of incidence of PCOS symptoms, obesity is only about 40%, but the most important thing is fertility issues, right? And then, of course, other testosterone-related hyperandrogenism issues. Now, some myths that I wanted to bust about PCOS. Women with children can have PCOS. Yes, they can, and women with PCOS can have children. In fact, PCOS is the most easily treatable fertility issue, right, compared to endometriosis or something else. Menopause or having a hysterectomy does not cure PCOS. We don't have to be overweight to suffer with PCOS. Even thin PCOS does occur, right? And PCOS cannot be cured by diet alone. You don't have to be overweight that I've finished, yeah. And oral contraceptive pills do not cure PCOS. It's just a symptomatic treatment for PCOS, right? When I say, as I said earlier, irregular periods are one of the main, diagnostic criteria, and it means that anybody who's having less than 21 days cycle or more than 35 days cycle, in PCOS it's more than 35 days. So 3 months, once in 6 months, these are the kind of irregular cycles they have. And both decreased menstrual cycle regularity and dysfunctional uterine bleeding, which means, they do have a period after 3 months, but then it's a very long, sort of protracted, heavy flow. These are all the clinical consequences of menstrual irregularities. So there's also, because there's so much estrogen, more estrogen, the lining of the womb becomes thicker and thicker and thicker, and that may put the woman to risk of endometrial hyperplasia or carcinoma, that means a uterine cancer in the long term, right? And generally, PCOS patients do not have premenstrual pain during ovulation, right? So that's very important to understand, right? Now, what do we do once we diagnose somebody with PCOS? And it could be as early as 15, 16, 17 as well, right? Of course, we run some tests. We confirm the diagnosis. We start with lifestyle changes, and that's the underpinning, sort of management, and that's what I'm going to talk about in the next few minutes. The hormonal medications, depending on how bad the menstrual disorder is, and of course, further referral to. This is a PCOS, that's why I do my PCOS clinics as a multi-speciality clinic. I have a dermatologist, I have a sonologist, I have a counselor, and I have endocrinologists and even diabetologists in the team so that it is a multidisciplinary way of managing PCOS. And of course, exercise specialists, fitness specialists, dietitians, all these matter, So that's why I said further referral. I don't know how many of you have read this book, Eat, Move, Sleep. Have you all seen it at least? Yeah? No? All right. Great book to read, right? Essentially, our quality of life boils down to this. Eat, move, sleep. That's it. And do it the right way, right? All of them have their own proportions in our life, right? And so when I start with healthy lifestyle, it's being as active as possible. Snacks, exercise snacks. Exercise snacks while going up and down the stairs, or even sort of doing a few burpees between your meetings, whatever it may be. Eating a balanced nutritional diet, not sitting for long periods, stopping smoking, reducing alcohol consumption, monitoring weight, and avoiding excess weight gain. We all know about this, right? But what is it that, when we talk about diet, especially Indian diet, what is it that we're looking at? You all know about this. I'm not going to talk much about these things, which you already know, right? But the most important thing, and it's one of my favorite slides, think before you eat. And this is not just for you, it's for your daughters and your, people, your juniors, and people who actually are you mentoring, right? So one donut, 242 calories, right? And you've got to do 88 minutes of crunches to actually burn those calories. Similarly, a milkshake, which is really heavy, maybe a dry fruit milkshake or something like that, 780 calories, lots of chocolate, 72 minutes of skipping is what you need to do to burn those calories. So where are these going, those excess calories? They're all getting into your visceral and your sort of subcutaneous fat. And that's what is causing inflammation in your body. Inflammation is leading on to so many other problems, right? So it's important to understand what is it that you actually consume on a daily basis. And that's why I love talking about smart plates to everybody I meet. Whole grains, quarter plate, proteins, plant proteins or animal protein, preferably plant proteins, quarter plate, and half the plate on greens and vegetables, right? And of course, seeds, nuts. They're extremely good for PCOS, nuts and seeds, right? And mindful eating, more than anything else, eating mindfully, not watching telly or reading a book or talking to friends while eating, because unless you chew something that you eat at least about 20 to 30 times, it's not going to get assimilated. The nutrients are not going to reach your system, your blood, right? So mindful eating and eating at timely intervals, right? So these are very, very important. I'd like to bring your attention to gut microbiota, and there's a lot of research going on in this, and I'm sure many of you are covering these in your sort of articles. But gut microbiota is the other world within us, which is actually helping us in a big way. In fact, there is research to say gut microbiota also affect your mental health or your stress levels. So you've got the right microbiota, you're going to be better in every sense of the word, right? Choose foods low in fat and sugars, of course, plenty of veggies, fibrous fruits, dals with skin, the skin, and whole grains. These are all prebiotic rich. And introduce probiotic-rich foods in the diet, like curd and buttermilk, help a lot definitely in PCOS, and avoid maida products which are processed, right? Crowded slide, I know, but you can take a picture of this, but this is in terms of Indian food, right? Anti-inflammatory diets, turmeric, beautiful, excellent anti-inflammatory, right? Reducing ages, so it's basically, in terms of frying and broiling, grilling and roasting, right? These yield more ages compared to boiling or poaching or stewing and steaming. So I think little changes in the way we cook our food, directly from the farm to the mouth, right? Better, less processed, more locally grown, less emphasis on carbs like roti, rice, and millets, right? And more emphasis on pulses and dals. And also, in terms of, oils, the right kind of oils which have, MUFA, inclusion of nuts, inclusion of fish and fish oil supplements, and moderate use of sweet, locally grown fruits like jamun and guava, instead of high GI like mangoes and lychee. So again, even in fruits, there is low GI glycemic index and high glycemic index, right? So choose the fruits as well in the right way, right? Again, another important slide. For all of us, less than 85 centimeters waist circumference. We must achieve that somehow, right? And this makes a huge difference to our lives. And a body mass index of 20 to 23. As I said, we're all thin fat Indians. We've got to monitor weight regularly, get those weighing machines where you can check your body fat and all your muscle mass and everything else. Makes a huge difference when you're actually training and regularly checking, right? Now, in terms of the other aspect, as I talked about eat, now I'm going to talk about move. We're talking about moderate exercise. Moderate is a key word. Not extensive, intensive training, not, high-intensity training. We've just got to reach, let's say, about 60 to 70% of our sort of maximum heart rate. What that helps us do is increases circulation, increases flexibility, promotes detoxification, and reduces stress as well, right? So why not HIT in PCOS? Because high-intensity, strenuous, prolonged exercise increases cortisol level, which is a stress hormone, which then lowers thyroid levels, which then lowers metabolism. And we don't want lowering metabolism in PCOS. We want our BMR to be very, very high. And this is the general way we need to do it. 3 to 5 times a week, 30 to 40 minutes, 60 to 85% of our maximum heart rate. Ideal heart rate about 130 to 150, not 160 and 170s. Start slow and build up slowly. And what is it that you can do? Brisk walking, Zumba, aerobics, leisure bike training, yoga, light jogging, swimming, etc. Not things like HIT and weight training and all that, right? So these are the various ways to keep that going. The other main factor that I find in urban population especially is irregular shifts. That really messes up with our circadian rhythm, right? And I see a lot of PCOS and a lot of hormonal disorders in those who do night shifts and irregular shifts. So we really need our melatonin, we really need our circadian rhythm to keep us at the optimal health, right? So what is melatonin? It's basically a hormone produced by the pineal gland in the brain, which only gets released in the night when there's absolute darkness. So having your tab on or some bed light on or some charger light on is not a good idea. Completely dark screens. Those of you who do night shifts, again, dark screens, black screens, so that you have absolute darkness when you sleep. And this helps you with all these problems, right? So that's why I say eat, move, sleep. And sleep, these are all strategies of a good sleep hygiene, having a good particular time of sleeping and particular time of waking up and sticking to that time. Of course, as an obstetrician gynecologist, I myself cannot follow it many times, but I try my best. And again, a few tips to help a healthy sleep, right? And another important aspect of PCOS, emotional well-being, right? If somebody is feeling down, for about 2 weeks, it's occasional feeling down is absolutely fine, but little interest or pleasure in doing things, or feeling nervous, anxious, etc., not able to stop or control worrying, that's anxiety. So these are the questions to be answered. And this can, detect early anxiety or depression in a better manner so that, we can work on it. We can help those youngsters come out of it, whoever it may be, right? And of course, menstrual issues also affect mental health, effect of estrogen and progesterone. So as a runner, I choose the second half of the cycle. I choose the first half of the cycle when I have to do, competition runs. I don't choose the second half of my cycle because I know the progesterone is going to cause trouble. So it's all about balance. It's all about finding how, being in tune with your body and understanding your body better, right? And of course, premenstrual syndrome is also a problem with menstrual issues in terms of having more progesterone in the second half of the cycle, and that's when you start feeling low and bloated and, irritability, etc., right? And yes, do irregular lifestyles accelerate medical issues? Of course. Even a bad sleep can accelerate hypertension, obesity, diabetes, cancers, Alzheimer's, dementia, mental health problems, right? So now coming to a little bit about PCOS and fertility, as I said, 70% women may experience problems with getting pregnant. 30% manage to get pregnant somehow, right? But when we do have PCOS as a cause for fertility, it's the best cause to treat because it's so easily treatable and the pregnancy, chances are much higher, right? So it's good news, easiest to treat. And then, of course, coming to other treatment options in PCOS, these are all, individual, and I don't want to delve too much on the nitty-gritties, but, things like symptomatic treatment, combined oral contraceptives, giving them a referral to a dermatologist, fertility treatment for egg release, other hormonal imbalances like thyroid, use of insulin sensitizers to help the insulin work better, etc. And of course, bariatric surgery for those who have a body mass index of more than 35, have been able to do lifestyle changes, but no change. They haven't been able to achieve the weight loss. They can definitely have bariatric surgery, right? So in conclusion, PCOS is a hormonal disorder. It is a metabolic disorder as well. And prompt diagnosis and proper diagnosis is important. Long-term follow-up is essential. It's not like it goes away, right? People, I see, women getting scans done on a yearly basis. Oh, PCOS is gone. Scan is not a way of telling you that the PCOS is gone. It's a lifelong issue which needs control lifelong, right? And fertility can be restored. Underpinning management is lifestyle changes. There's nothing beyond that. And here today in this symposium, I'd like all of you to take this oath. This is a mantra for life. We have to aim to be fit at 40, strong in the 60s, independent in the 80s, and nimble in the 90s, right? So I think we should all aim towards that, right? Agree? Thank you. And there's just a book about 9 months. It's outside, it's available outside. It's also available on Amazon. And these are the other books I wrote through Rotary for young girls to understand their own health, right? And it's translated to Telugu, Tamil, and Kannada. So with that, thank you very much for your patient listening. And I'm open to questions. Thank you very much.
Aruna, be fit at 40, strong at 60, eat, move, and sleep. While 1 in 4 women in Bengaluru have chances of developing PCOS, Dr. Aruna gives us the right tips to take care of ourselves and manage PCOS well. Thank you so much, Dr. Aruna. We have the signed copy of Dr. Aruna's book, 9 Months Journey of a Lifetime, right outside. Please visit our stalls and be lucky to get this book and get more information about women's wellness. I now request Mr. Kumaran to take over. The floor is now open for questions.
Yeah, hi. My name is Anita.
When you're introducing, please introduce yourself and then you can take
I'm a
questions.
nutritionist. You spoke about visceral fat and subcutaneous fat. What is the range you would advise?
In terms of the actual proportion, right? I rather, focus on the trending rather than the actual, sort of proportion. For example, if somebody has started off with about 30% or 20%,
No,
right?
I'm talking about visceral fat. What is
Yeah.
the range you would suggest? This is the visceral fat a person should have.
Right. No, I mean, as I said, there's a healthy range, but I would prefer the trending, to see the trending on a regular basis, right? So if they're doing a 6-month sort of program, it would be better to see the trending rather than actually the amount. So it's rather focus on the trending and see how that goes with your nutritional changes.
Okay. Why I asked you is, I have a client with a visceral fat of 5. Usually we recommend a visceral fat of 1 to 8.5. I have a client with 5 visceral fat, but still she suffers from PCOS. That's the reason I asked.
No, I'm not saying visceral fat is a reason for PCOS. It's a combination of even subcutaneous fat as
Okay,
well.
what's the
right?
range of subcutaneous fat you would suggest?
I wouldn't know the actual, sort of thing. But, the thing is, I look at the trending. So, as they get it down and get it below 85 centimeters, then automatically their cycles become more regular and the endocrine and the metabolic, sort of imbalance comes back to normal.
Okay.
Right? So I think that's something that you would be more sort of focused on.
Definitely.
Right? Yeah.
There was one more question.
So I do the waist measurements and the BMI in my clinics.
Okay.
I don't actually go by the, the actual measurements of visceral fat and all.
It is preferable that a person has a visceral fat of 1 to 8.5.
Right. Okay.
Yeah, it is very
And what
good.
is the Indian sort of standard?
It is for Indians itself. I'm talking about Indians.
No, what is the standard that you see, in your regular
Usually,
practice?
when I started my weight loss journey, I had a visceral fat more than 27.
That's the thing, So most of us do
So-
have it more than 10, 20. I've never seen anybody with a visceral fat of 1 to 2 in India. It's just
I
impossible
have clients
to
with
gain
visceral
it.
fat of 2, but still they have PCOS. That's a different
So the
scenario
average that I've
altogether.
seen is about 10 to 15%. And
Okay.
I haven't seen anybody with such a low visceral fat. So it's something that we are endowed with as Indians, I think, as compared to Caucasians. So I see the trending and, it's something that they can do on their own. And I check the waist circumference. So even if somebody is actually into exercise regimes, I ask them to check the inch loss or the centimeter loss and keep a track of that.
Okay.
Yeah.
One more question. Can I ask one more question?
Okay.
Yeah, you spoke about nuts, and definitely you spoke about walnut and almond. But when you say 1 to 2 serving of nuts, 100 grams of nuts is more than 600 calories. So,
No, we're not talking. 1 to 2 servings of nuts is not fistful.
Huh?
1 to 2 servings of nuts is not fistful.
no.
Servings of-
100 gram of nuts is equal to more than 600
No,
calories.
that's right. But the servings again differ. For example, fruits and veggies, it's a fistful. Right? But for nuts, it is just a tablespoonful. What I'm saying is the measures differ for each of these
No,
nutrients.
because when you mention about a balanced diet, when you mention about nuts, people are crazy about nuts.
No, they shouldn't be taking too many.
You have
You're
to
right.
mention
Absolutely.
what is the minimal or maximum quantity they can
There
take.
was one slide about measures, about what it means, one sort of measure of fruits and veggies is 1 fistful. When you come to salt, it's just about a table, not even a tablespoonful. When it comes to nuts, it's a tablespoonful. So for different nutrients, it's a different measure.
Yeah, definitely. But tablespoon of which nut also matters,
Yeah.
because omega-3 and omega-6 ratio
Correct.
always varies in different nuts.
Absolutely, absolutely. Even in pregnancy, that's a very
Thank you so
important measure. Yeah.
Yeah, thank you, ma'am. We can take the question here.
Hello, ma'am. I'm Neha. I'm also a nutritionist.
Okay.
So, can you tell me the relation between the gluten and PCOS? Because I myself have PCOS.
Yeah. So again, it's a very intensely researched thing. So as I told you earlier, that whole grains make a huge difference in terms of diet. So anything processed, for example, donuts or pizzas and things, they're very processed and they don't have the outer husk. So it's preferable to eat the outer husk as well so that the glycemic index comes down. The other way of dealing with high glycemic index, because we're all South Indians eating sona masuri almost every day, right? So it has a very high glycemic index. As soon as we eat, it just pushes glucose into our system. So probably starting off with salads and sort of changing to wheat or ragi or millets and things like that, or having some brown unpolished rice, etc., makes a difference. Gluten and PCOS is, it's a research thing, but I don't know of any literature which talks about gluten sensitivity being directly related to PCOS. It's more the metabolism of the carbohydrates rather than gluten itself causing PCOS.
Yeah, because the reason I asked is because I stopped gluten. It's been like 1.5 years, and I have seen a lot of changes in myself.
Yes.
The inflammation, the
Correct.
acne, everything is just gone.
Sure.
So that's the reason I asked.
The lights, please.
Yeah,
Right.
thank you.
So it's again individual. So for example, some of us have genes which make us insensitive to gluten. So you probably are one of those, and it's helped you. But not everybody in the population would have gluten insensitivity.
Yeah, I went for the TTG test also. That was negative.
Yeah. Oh, that was negative.
Negative, yeah.
Okay.
And the moment I start eating gluten, again, like 1 or 2 acne just pops up.
But we are so fully, sort of flooded with gluten, isn't it? It's so difficult to come off gluten, isn't it? And you've got to make huge changes to your body.
Actually, it's a lot of changes. Yeah, I can see like so many restrictions.
You look very healthy and fit. Good, congratulations.
Thank you so much.
We'll move to the next question now, please.
Yeah.
Hi, I'm Deep from Samsung Medicine. I'm an architect there. So I would just like to understand, are we missing anything from the ultrasound perspective that we can't do kind of early diagnosis of PCOS and PCOD? Yeah,
this very good question. This was happening a few years ago. Now with the kind of precision that you are giving us as an ultrasound, let's say innovators, we are able to find PCOS because of the sort of the resolution. We are able to diagnose PCOS better now. But we should be aware or wary of overdiagnosis. So if there are parameters, more than 20-25 follicles, we know that this is a polycystic ovary, right? Earlier, we were not able to do that with that precision. So yes, it definitely makes a difference. I think the current machines, especially a transvaginal scan with the right kind of probe, we're able to make the diagnosis fairly easily. Thank you.
Thank you. One last question, and then we can wrap up the session. Yeah.
Yes.
Thanks.
Hi, ma'am.
Hi.
Thanks for the session. My name is Dhanashri. So I have reversed my PCOS. I had cyst. My question is, I'm overweight, okay? But my body is flexible and I'm reducing my weight, but the journey is very slow. With respect to corporate job and hectic lifestyle, it's a little difficult.
Yes.
What would you recommend? Diet and only workout for 3 to 4 times a week just to go about it?
So I'm happy that you're saying you reversed your PCOS, but as I said, it's not just by the scan that we have to go by it.
Yeah,
right?
yeah.
Scan is one component of the whole thing.
Yes.
So you still have to work on your weight and keep it under control. And more than anything else, choose the right kind of foods, the kind of cooking and things like that.
Yeah.
But you have to keep at it.
Yes.
It's like a lifelong thing that you cannot miss. It's like brushing your teeth in the morning.
Correct.
So the moment you stop it, there'll be rebound.
Yes.
So it's important to be consistent with it. Right?
Yeah. And ma'am, one more thing what I wanted to ask is nowadays, especially for women who are 30 plus, they are coming up with a symptom which is known as vaginismus. Can you just guide on it a little bit how to deal with it?
Vaginismus is a completely different topic, and I think it's a little, it goes beyond our remit today. Sorry, we'll talk about it later.
Sure.
Yeah.
Sure. Thank you so much. Huge round of applause. Thank you, Dr. Aruna.
Thank you very much.
I request Anindya Chaudhary, CEO and President of Happiest Health, to please come and hand over the token of gratitude to Dr. Aruna.